of dated where they were talking about how, you know, Kettle and Rebikoff would be among the first to come down when, first let me introduce myself formally before I get up here and start talking. My name is Christine Rockledge. I've been working with Linda Christensen of the Preston Historical Society since, what is that, 2011, Linda?
Yeah.
Yep. I came to her looking for historical information. At the time I had been researching the hospital for about 4 years at that time, and you know, documented information in terms of like you know, things written in books and paperwork and whatnot were, you know, scarce and hard to come by, so I was hoping that Linda could kind of be like a foundation I needed. And she had a wonderful book that was the 1931 appraisal book with just, on your way, you know, at some point during the event, please take a moment to look at the book.
That someone, by the way, had found in a trash pile up in, I don't know, Bloomfield or wherever. And they realized what a, you know, what a great thing they had found, and so they donated it to the town of Preston.
The book is filled with, my God, close to 100, if not more, beautiful photographs of the property from 1931, and you can really see how even back then the grounds were so beautifully manicured and well taken care of. It did not look like a mental hospital, it looked more like a country club. And the thing that I think is very nice about Norwich Hospital is that care continued all the way through up to the closing with groundskeepers such as Jimmy John, who worked there for, my God, 40-some years, I believe, and wore a suit and tie to work every single day, even as he rode the mowers. And then seeing in the documentary, too, just wanted to take a moment to mention that as Dr. Papawala was on the documentary, I saw a lot of people here notice that he recently passed away. So, I wanted to mention that really quick. But, you know, as I was saying, as I came to Linda and, you know, we kind of started putting our heads together, and, you know, I started coming up with more information and speaking with a lot of people that worked at Norwich Hospital. It wasn't so much the things that I could have found in books about, you know, this happened at this precise year, or this happened at this time, you know, things like that that made it so special for me to research it, is in talking to everybody that worked at the hospital, it was not just a job to people, it was from the heart. Norwich Hospital had a large staff of people that cared tremendously for their patients and for their work, for the hospital itself, and I've heard just so many, countless wonderful stories that, I mean, I wish I could tell them with the same enthusiasm and same exuberance and just same heartfelt feeling that people like Karen Kingsley and Kathy Martin have told me. Ed, you've told me stories, and I wish I could duplicate that and retell them, because some of them are absolutely wonderful, but I can't because I didn't work there. I just like have for the past 5 years been doing what I can to you know, document and preserve the history of the hospital, not only because of my personal fascination and interest with it, but because it's for the hundreds of people and the numbers of generations of people that work there, that these stories should not just fade off into the dust. So, in my 5 years of research and whatnot, I have kind of compiled probably about a quarter of everything that I've learned and experienced and whatnot in a book entitled More Patients, Less Patients, A History of Norwich Hospital, filled with a lot of historical photographs and photographs taken within the past 16 years since closure. I encourage everybody to take a look at it, and you know, it's not so much for me, it's for everybody that worked there. Trying to cover just 92 years of service alone from the moment the place opened through its first administration with Dr. Henry Pollock, which was very good, and then the, you know, years that the hospital went through in the 1930s and whatnot, where things started to become very dismal and investigations were made as to poor conditions, patient mistreatment, Things perking up a little bit under the administration of Dr. Bryan, but still not quite where they should be until the 1950s with Dr. Kettle and Dr. Martin as superintendents to really give Norwich Hospital that boost and that facelift it needed to become such a proud part of Preston's history and Connecticut's history and in mental health history. So how many Norwich Hospital employees are here today? Wow, that's a lot. Would anybody like to share any memories or stories?
No, I have a question to ask.
Go right ahead.
In your research, have you ever come across a book, Administrative Psychiatric Hospital by Dr. Kettle?
No,
No, well, he wrote a book.
I did not know that.
Oh, yeah. He wrote a book, and it was used at Yale University, and anybody taking mental health or medical courses, and that book was used for a number of years. But I never could find one. I've been researching everywhere.
Oh my God, I had no idea that he had written a book. What was it called again?
Administrative Psychiatric.
Administrative
Psychiatry. Administrative Psychiatry.
I'm gonna have to
By
remember
Dr.
that and try to
Ronald
find
Kettle.
that.
Come on, I saw a few of you here with some, okay, there we go.
There we go.
I started working at the hospital in 1974, and I worked on the launch building for like probably 6 weeks, and then went down to Kirkbride Ray, and
Right.
eventually Stribling. And it was interesting because they had patients on those units that had been there since 1929, and their cases were never reviewed. In the 70s, they started having to be reviewed by the probate court every
Right.
2 years. So that wasn't always the case. People would be there for 40 or 50 years and be on the back wards and, treated. But it was in the 70s when they started the institutionalization that every 2 years, every patient had to be reviewed, and that was 2 doctors would evaluate them and bring it to the probate court.
So that seems to be when things
And
started
then
to
in
get like unearthed.
And then in 1979, when the union threatened strike, they shut down Kirkbride, Ray, and Stribling and moved all those people to Kettle and Seymour. So basically that left the back wards closed down around the summer of 1979. They lost 9 patients that summer.
What year did you work at Norwich
In
Hospital?
74, and I retired, well, I left there and went into forensics in 88 and just retired in 2010.
So you were there.
74 to, yeah.
So you were
88.
there as it closed and whatnot?
No, I was
No?
in forensics, I went to forensics in 1988, so I
Oh,
was there
okay.
from 74 to 88, but I was still in the Russell building, working for the court clinic, so I was still in the grounds of the hospital, just not working for the hospital.
Oh, okay, because I remember coming across reading something that said something about Kirkbride becoming a building to aid with homeless people and whatnot.
They were homeless shelters
Yes,
in the
yes.
80s.
And I can't.
And it also reopened as units.
Yeah, it
Yes.
reopened as
Yes.
outpatient, the first, Bill Newkirk went down there, the first outpatient treatment, what did they call them? Was it SMUC? They, after the homeless shelter was there, or maybe at the same time, they started opening the outpatient, it was transitioning to outpatient, and Kirkbride had held the offices down there.
Yeah, I had read a little bit here and there about it, but like I said, it's really hard to find anything documented on a piece of paper, and that's not really how I want to find anything anyway, because you're not finding like a personal account of it. The words scrawled on a piece of paper, printed on a piece of paper is only so good, but when you actually talk to somebody and you hear that firsthand experience and you can feel that firsthand experience.
Patients didn't have
so
their
much better.
dentures or their rings or their clothes.
Right.
A lot of them had Johnnies on it, would be sitting in chairs. It was in the 70s or 80s they started having their own cubicles and their own calendars and their own pictures of their families, and it was more personal.
Yeah. Thank you very much. Anybody else? Yes, go right ahead.
When I first started, I worked there, then left and then came back. But I believe I started in 1970, and I always worked the medical unit, and I started on the lipid building. And the hospital had its own operating room. and they would consult surgeons from Bacchus that would come and do surgery, because the hospitals did not know how to deal with our patients, and we did. You know, we could make our patients comfortable, and we weren't afraid of them. Like at that time, they weren't as educated about mental illness. So we had our own operating room. I don't think people were aware of that. And we had our own central supply. We did all sterilization of our own implements for surgery, and we would take care of them post-op. It was sort of like the anesthesia and the whole business, and we would follow them through until they were able to go back to their own units throughout the hospital, go back to Lodge or Kettle. They would stay on the medical unit pre and then post-op, and we would, you know, even like post heart attacks, you know, we would take care of them. So it was very interesting. I did love that experience.
Thank you very much. Go right ahead.
Is there any talk about a permanent museum or?
Not that I know of yet. The last.
Well, we're working on it.
Yeah.
Through the town, we're trying to save the administration building. We are, they've saved the fireplace and several pieces from the hospital, as we have with some of the things we have here. We hope to be able to create a little museum over there someday, but we've got to start doing more with the redevelopment agency that's been working very, very hard. And hopefully, as the year progresses, we'll move along.
I hope so, because I would love nothing more than to see administration become a museum for it, and you know, could also become town offices too. It's such a beautiful building, and
It's a very historical
so much
building.
behind that one building alone, and it represents like the face of the whole campus.
Right.
I think definitely it should become a
Because I
museum
have,
for
you
it.
know, pieces that I would like to donate to town.
Oh, that would be amazing.
We'll call you.
From the print shop? From the print shop?
Printing department, yeah.
Where was the printing department?
In the Ray
located?
building,
In the Ray building?
Yeah, it ended up in the Ray, but it wasn't the occupational